Okay, so you can finally see my slides. Thanks for the invitation also. My name is Michael Wagner. I'm a neonatologist at the Medical University of Vienna. Thank you, Gerhard, for the very nice presentation. And I really liked your last slide. It kind of transists to my presentation, because you said we should look more on the neonate while we use a lot of monitoring. And my presentation will be about the use of eye tracking during neonatal resuscitation. So who in this room has heard about eye tracking technology before? Okay, some, that's nice. So first I would like to start with my disclosure slide. I have no conflict of interest regarding this topic. So we heard a lot about neonatal resuscitation and the neonatal resuscitation guidelines already. So neonatal resuscitation, extensive resuscitation with chest compressions is a very low frequency event, but still it's a very high risk event, and it's a very stressful event for all the healthcare providers that are involved in this situation. And I guess most of you who have been in such a situation with an asphyxiated baby or a baby who needs resuscitation, chest compressions, a tube, adrenaline and all that, felt like this. A situation which seems very chaotic, where it's unclear who's the team leader, who is responsible for what, and still everybody tries to help the patient. So we would like to have a situation that looks more like this, where everybody knows exactly what to do and where everybody works very efficiently together to come to a common goal. Where can we learn this? In a simulation-based medical education. That is an intervention that tries to mimic a real situation with a simulated patient, and where healthcare providers have the opportunity to train these very rare but high-risky events. This is what it looks like in our simulation center. So we have a designated simulation center where we have different mannequins from preterm to term and also to pediatric patients. We have an audio-video system where we can record what the healthcare providers are doing and then do a debriefing afterwards. We can also do this in an in situ situation. So we take the simulated patient and have the situation where we work every day together. And again, also audio-video record what's going on in that situation and sit together with the team and debrief that situation later on. So what most of you learn during med school is the medical and technical skills. It's airway management, chest compressions in a neonatal resuscitation, what medication you need, and what vascular access is the best. But what you don't learn is human factors, the non-technical skills. So how can we improve teamwork? What's the best communication within the team? How can we do a decision-making together as a team? Who's the team leader? And we also don't learn a lot about situational awareness, which is part of the human factors. So what is situational awareness? It's to knowing what is going on around you. It's every situation that is perceived and recognized and understood and also integrated, and based on that decision based on that perception of everybody in the situation, a decision is made afterwards. And it's also described as a link between vision and cognition. And I also really like the quote, "Our eyes are the mirrors of our soul." That brings me to eye tracking technology. So eye tracking technology is not something that will be available in the future, but it's something that's already available. And what can be used to study human factors, especially situational awareness. So eye tracking technology is glasses that any healthcare provider, any person can wear, and where you can record what's going on with an HD camera. And you have different sensors that are tracking the pupils and the pupil diameter and what people are looking at. And why is that important? Because we know from previous literature, psychologists use it very often, also radiologists used it, and surgery, that 70% of decisions of experts are happening subconsciously. So if you ask them, where did you look at in that situation and why did you make that decision, they often cannot answer it. And we also know from previous literature that that what you look at really also influences your decision making. So it's interesting to know this correlation between attention and experience. So inexperienced providers, experienced providers, and also distraction. And distraction is especially interesting when we use new technology, new sensors, a lot of monitoring, and we need to figure out what is the right attention to these new monitors and what really helps the baby and what is too much of a distraction. So this is what eye tracking. Yeah, that's exactly why I wanted to use my computer, because now the video is not working. Do you have any idea how I can run my video? Okay. It's a pity because there will be a few videos, but nevertheless, I still try to give you the idea of what eye tracking looks like and how it works. So somebody is wearing the glasses and you can see in real time what this person is seeing. And then later on, you can map the whole situation to different areas of interest. And that's why it's so interesting also for research. So you can have an area of interest like the nurse or or any monitor in that situation, or the baby, of course. And then you can calculate the time to first fixation on that specific area of interest, the total fixation duration, and many more parameters. So how can eye tracking be used in neonatology? So again, this would be a very nice video, but I cannot show it to you, unfortunately. Okay. Ah, here it works, okay? Let's try it like this. Okay, you don't see it anymore? Ah, here. Okay, let's do it like this. Okay, so in this situation, a healthcare provider, so I don't see the slides anymore, I'm very sorry. So the healthcare provider is wearing the glasses and you can see a lot of monitors and you see the gaze pattern of that provider in real time. And you see that the provider is not looking very much or very often at the infant. And that's something that you only realize when you're using the glasses and see what providers are doing. So try to switch to the presentation again. A very technical session with a lot of technical problems. So we did a pilot study together with the University of Alberta where we used eye tracking for the very first time in a clinical setting, in a clinical neonatal setting. And 6 healthcare providers were wearing the glasses. And what we identified is that in only 35% of the time, the providers were looking at the infants, whereas nearly the same time, they were looking at peripheral monitors. There was another study by the group of the Children's Hospital of Philadelphia. They again used eye tracking for the team leaders, and 18 providers were wearing the glasses during resuscitation of preterm infants below 32 weeks. And again, the same pattern, they were predominantly looking at the infant, a little bit more than in the Alberta study. It was 57% here, but again, nearly 30% also on monitors. During my time at the Yale University, we used eye tracking in a simulated setting because we were very interested not only on the team leader, but also on the person that was just responsible for the airway. So in that situation, there was a specific airway person and an additional team leader. And 13 healthcare providers, all experienced healthcare providers, were wearing the glasses. And it was very interesting to see a common pattern in all of these providers. Again, I switched to this slide, to this version of the presentation. Yeah. So here the other person is wearing the glasses, preparing. starting with bag mask ventilation, looking at the mask and at the chest. So that's what we estimated. We thought that this will happen. Sometimes also on the monitor, as also shown in the real settings. And then the chest compression started and the preparation for the umbilical line started. And now you see a pattern that we saw in every single provider, that the gaze shifted away from the mask and the chest towards the umbilical line insertion, and the providers even stopped bag mask ventilation in that situation. So they were kind of distracted. And when you have these videos, and if you can show these videos to the providers, they understand that they really should focus on what they're doing, on their task, and not on what's going on around. Here you see a heat map, so we can also visualize all the providers together. And you saw that during the time when the umbilical line was inserted, there was a distraction happening. So we also used feedback monitors, like a chest compression feedback monitor in the simulated setting and the respiratory function monitor, because we know that they could be helpful, but it's also the question how distracting they might be. And again, you can see a heat map. You can visualize what you see when using eye tracking glasses. And 40 participants in this randomized crossover study, we identified that we had significantly better results with the feedback devices, and that the feedback devices, again, consume a lot of visual attention, about 40% of the time. So this is an attention that still is okay, because the quality of ventilation chest compression was better than without the monitors. And we did a secondary analysis of that study where we only looked at the masked group. So we had the recordings of the ventilation and the chest compression quality to see kind of the outcome. And the more the providers shifted their gaze from patient monitor, patient nurse monitor, compared to providers that were just looking on the patient or just looking shortly on the monitor and then back on the patient, so more time on the patient, they had less mask leak. So it's kind of beneficial, and that's also what we know from previous literature, that providers with experience that don't have that much gaze shifts to focus more on the patient. And that seems like to be a good thing for the patient outcome. I would also like to introduce you the possibility of using eye tracking for virtual teaching. So especially during the COVID-19 pandemic, we had the problem of the social distance measures, and we had less or decreased bedside teaching. And so what we did is to use eye tracking technology to do recordings of real situations and then discuss it together with the team, also virtually, so that everybody had the chance to learn from a virtual bedside teaching. Together with the Leiden University in the Netherlands, which was very experienced already with video recordings during neonatal resuscitation, we tried to use eye tracking outside of the delivery room. So we tried to do video recordings of real situations on the NICU, like intubation, insertion of lines, and less invasive surfactant administration. So this was an observational study, the feasibility study. So again, a video of what it looks like in a real setting. So the provider was preparing for intubation. And when we discussed it together with the team, we identified that the provider always looked over the shoulder to see the monitor. And we discussed, for example, that it might be beneficial to be on the other side of the bed, because then you can focus on the patient while you can also see the monitor more easily. So just to give you an example of what you can learn out of those videos. And we identified it was very feasible to use the classes. It was not distracting. And so we also had questionnaires, and most of the providers attending these video debriefings said that it was very beneficial because they finally were able to see situations which they wouldn't have seen otherwise, because you're not always on night shift. And then there's a resuscitation during night shift, and it just happens like 10 times a year. And if you're not there, you don't see it, you don't learn anything. And when you record it, you can learn it. And with the eye tracking glasses, we are very mobile, and that's very beneficial. We also used eye tracking for virtual workshops. So one provider was wearing the glasses while doing, for example, less invasive surfactant administration. And we were able to connect to over 400 participants at the same time, who were able to see what we were doing and ask questions and discuss virtually. And it's also interesting for the NICU itself, because we have a lot of students and residents, and no matter if there's surgery at the ward or if it's a preterm baby that is born, there's always a lot of people around it. And so the students or the people that are not working at the patient, they usually don't see anything that's going on at the patient. So when the provider, the surgeon, or the neonatologist is wearing eye tracking glasses, you can stream in real time what's going on, and they see, they're not just in the room, but they can finally see what's going on while being in the same room or being somewhere else and just watching the live stream. And just a short excursion to augmented reality also, because this might be the future. This is not here yet. So augmented reality is glasses where you see a hologram or a virtual object in the real world. This is different to virtual reality, where the real world is completely blocked. And when we come back to these findings, when we see that we look a lot of time at the peripheral monitors, while we know that the monitors help us to understand how we can improve our care of the patient, augmented reality might be a potential technology where we can bring the monitor over the patient. So I'll just give you a video of a pilot study we did. So we developed a streaming device where we can stream in real time the video laryngoscopy monitor. And you can just place it over the patient and see the monitor, but still focus on the patient. You don't need to look away of the patient. And that might be the future or a solution of including technology and monitors while still having the possibility to focus on the patient. And it could also look like this, where you have respiratory function monitor, a video laryngoscope next to vital parameters. So there's several possibilities here. And there's also the combination of augmented reality and eye tracking, where the glasses are identifying that you are distracted, but your focus should be on a specific area like the chest or the mask. And then it guides you with a hologram and tells you, hey, you should focus on your task and don't be distracted by something else. So it's not there yet, but maybe in the future. So to summarize, we should also study and be interested in not only the medical part of the neonatal resuscitation, but also the non-technical skills, the human factors, and identify what or how experience or environmental factors are influencing how we take care of the patient. For example, monitor position is also interesting or important part. And of course, we need to do more studies and find out what is really the benefit for the patient. Thank you.
Thank you, Michael, for